it's Friday, October 26th, and it must be time for another update from your North Carolina Medical Society. We're not in session right now. We have been in and out, but a lot has been going on in the meantime. One big announcement you saw this week is that Medicaid, the Department of Health and Human Services, has actually received approval for the transformation waiver. So not only were RFPs received by 8 different companies to bid to become a new managed care entity, but we've also gotten federal government approval to go forward. So come February of 2019, we're going to know what we're doing next. In the meantime, we're just waiting and holding. Nothing can really be done between now and then, so we're just kind of hanging out. The big news, though, that you've probably been hearing about is the state health plan, and we've heard a lot from our members about that because, first of all, they proposed a massive 15% cut to get to $300 million in cost adjustment savings. Then they took that back and said, no, we're not going to do those immediate cuts in 2019. What we're going to do is we're going to go to a new reference-based pricing in 2020. And Sue-Ann and I and others have been doing a lot of research on this, trying to figure out exactly how this is going to impact your practice. And we need you to communicate with us about that also, because you have a better feel of how it's going to impact your patients and your practices than we do sitting here in our offices in Raleigh. So we sent out a communication yesterday asking for you to tell us in general how that's going to affect your practice, and so that we can put all that together and advocate on your behalf with the state health plan over the coming weeks.
So we also have something else going on in the midst of the state health plan and all the other things that we're working on here at the Medical Society. Yep. It's election season, which I'm sure you've seen in your community, a number of yard signs and campaign signs and mailers that are coming to you. So make sure that you are getting out yourself to vote here in early voting and on election day. Yep. Don't forget that you can look up your own sample ballot beforehand at NCSBE.gov, and that's a very easy way for you to review who your candidates are before you head to the polls. Also, the North Carolina Medical Society PAC met recently this past week to endorse 3 different judicial candidates. Yep. The first was for North Carolina Supreme Court, and we endorsed Justice Barbara Jackson. And then 2 other appellate court seats, the first being Allegra Collins and the second being Andrew Heath.
So remember, those are seat 1 for Court of Appeals is Andrew Heath, and seat 3 is Allegra Collins. We did not make a recommendation in seat 2. And I know these are confusing times for you to try to figure all those out. We would still advise you to go back to your local newspapers because they always put out nice descriptions of who all these folks are. But we endorse these 3 judicial candidates. But you'll need to look at your local newspapers for your district court judges that are out there and the other judicial races that are really more personal to your area that we don't have as much interaction with. We're going to be back to talk to you again about some more legislative issues, not just the state health plan or Medicaid as we've been talking about so much, but in November we're coming back right after Thanksgiving for another session before we go into the long session beginning in January. That session is open to a lot of different issues. So we're preparing for pretty much anything. We'll keep you informed about what we see coming down the road that might affect health care. I could easily see the state health plan being a topic of conversation. I could see Medicaid just always being a topic of conversation. Scope of practice is always out there, and we have to be ready to answer questions around that. In addition, they're going to be talking about whichever of the constitutional amendments pass on the November ballot and how those would actually be enacted in the coming years. So, like I said, it's a wide open field. Who knows? Hurricane disaster relief could be out there as well. Just to wrap up, if you haven't heard yet, and that would surprise me, but we started a disaster relief program. So be sure, and if your practice was impacted by Hurricane Florence, we would love for you to apply so that we can help make sure your practice is getting back up and sustaining health care in southeastern North Carolina. If your practice wasn't impacted, we'd love to have you contribute a few dollars to this, because this is helping out your fellow physicians and physicians' assistants get back up and going after a really hard-hit disaster. Until November, we hope you get out and vote. Call us if you need us, because we're happy to help you go through your ballot. And we look forward to updating you on what's going on down on Jones Street in just a few weeks. Have a good one.